Whoa.
Okay. Okay, there we go.
Wow. Whoa. Look at that.
Is that shaky?
Yes, my knees don't touch.
Yeah. Okay, hi, I'm Dr. Sue, and we're here with Terry today. And how are you doing today, Terry?
I'm good.
Okay.
Excited.
Okay, all right. Excited and a little nervous, right?
Yeah.
Okay. We're going to do what I call the knee complex, or a lipo 360 of the knees. And what we do is completely different from what other doctors are doing out there. It's something that I've been working on for a long time, since we specialize in doing the ankles, calves, and knees here in this practice. This is one of my main focuses since I'm treating lipedema so much. But anyways, I wanted to show you an example of the knee complex. And instead of doing just the knee, okay, so when other doctors talk about the knee, they're talking about this little bulge right here, about a hand-sized area that just brings us in. But when we talk about the knee complex, it's oftentimes for patients that have a lot of thickness right here and on the top of their knees, and it's going all the way around, 360-degree fashion. So what we're trying to do is get not just slimming here, but coming down onto the calf, slimming up into the thigh, slimming on the outside, and we get this nice shape that comes in like this. And it reveals the calf muscle, and it reveals the nice curvature in here and a little curve in here. So I'm going to have Terry stand just about right there. Actually, back up just a little bit. I think we're going to need a little more room. Come forward, Terry. Is that about good?
Yep, this is about good.
Okay. All right. So as you can see right here, Terry's got a lot of thickness right here. And let's bring your legs a little bit apart. Okay. And which we were talking about earlier is she has, a normal upper thigh, but then as we come down to about this point right here, it's straight and it's bulky right there. So what we want to do is bring this in kind of like this right here, so that the leg tapers down, and it's, if I'm doing this correctly right now, and it's hard for me to see, then it's thinnest at the knee, okay? And we want to blend it down to about mid-calf, because as you can see, she has a fair amount of fat right here, and she's lost the inner curve right here. So we do this, bring this in, it's going to be something like this. Is that good?
Yes, sir.
Okay. All right, so that's what the knee complex is, and turn a little bit for us, Terry. Okay, that's good. Terry has some on the front. Some women really have this, a lot of thickness right here, and it looks bulky. On hers, it slopes down, but she has some thickness coming up into here. And turn facing the camera here. The fat on the sides right here really makes the knee look kind of squarish, I think. And also the little fat that accumulates around it hides the kneecap. So without being able to see the kneecap, it's hard to have an attractive looking knee. So we're going to see a hint of her kneecap. Hers doesn't stick out as much, but we'll see something that looks a lot slimmer. Okay, and we'll see how that transforms the entire leg. All right, so what I'm going to do for you guys is I'm going to show you what change is going to be. So we're going to be doing lipo from right here. I don't know if you can see this mark right here, but I'm going to come up to about mid-thigh, and we're going to go all the way down here to about mid-calf. We could do all the way down here, which I do all the time, but in this case today, Terry's decided just to do the knee portion, and I think it's going to bring back her shape. It's going to do this right here. So we're going to see that everything cuts in, and her knee is going to be the most narrow point. And that makes her whole leg look a lot more beautiful. And let me see if I hold this. What you can also see here is that we can see a little bit of her calf. It really brings out the upper edge of her calf right there. So the knee complex is important to achieve all this. Like if she had your typical knee liposuction, this is what would happen right there, that little bit. You can't change everything without going into this whole circumferential structure here. And this is something that I would say very few doctors, maybe, I don't know, if you had 1 or 2% of doctors that have ever attempted anything like this, that'd be crazy. But I do this all the time because I do lipedema cases probably about once a day, and we're working up in this almost every single day. into this frontal knee area, which so many doctors are afraid to go into. And then this area right here, which I say is overlooked by almost all the doctors that do knees. They do this little thing right here. Is it okay if I tell, you know, what? So Terry's already had a inner thigh lipo and a thigh lift by another doctor, but her skin is actually fairly nice, and my opinion is she didn't really need a thigh lift. She needs more lipo up there, if anything, to get rid of some more of the thickness, but her skin wouldn't have been loose in my opinion, and it won't be loose from this. This is going to come in and it's just going to give her a beautiful shape. But she's already had some, you know, some volume taken from up there, so otherwise it may look like a mismatch. But we're going to match everything up that didn't, you know, come out well for her to begin with. Okay, so we'll come back and show you guys in a little bit. Thank you. Oh, before you turn, hey Terry, you want to tell them what you've been thinking? Like, why did you come here? And
Well, I've been watching Dr. Sue now for about 2 years. A couple years ago, I guess I was a little nervous about it because I've had failed procedures before with my legs. They told me it was hereditary, or there was really no way to fix it. And they just told me all these lies, took my money, did what they did, and it just didn't come out right. But I watched Dr. Sue for so long, and I've seen so many results. I really thought it was too good to be true until now. Yeah. Now that I'm here, I know that it's real. So I'm just ready to see. Yeah. I've never wore a pair of shorts, and I'm 32 years old.
So thank you for saying that. But so I'll tell you, like, you know, not everything's a failed procedure, but I'll tell you what I see all the time. That I think doctors, many doctors out there, cosmetic surgeons, board certified plastic surgeons, what I think the failure is for them to recognize what a beautiful shape really looks like. Not all doctors really have a very good artistic sense. And doing just the inner thighs on her and just overlooking everything around the knees tells me that the doctor who treated her before either had no experience treating that area or just overlooked it, which it could be either one, because they don't really teach you how to work the knee area in training. And I think doctors just say, okay, well, we've done the typical thigh and that's just how you're going to look. Yeah. Well, it's what we do here is way, way beyond the normal. You know, I've really pushed the limits on what we can do with ankles, calves, knees, you know, since we do 360 here so commonly. But part of this is a failure for other doctors to really, you know, do things completely or see things. So, not that they try to lie to you, but yeah. But I think their sense of the aesthetic is sometimes limited.
It is.
If you're not a specialist, you know, working in this area. So thanks for watching. We'll come back and show you some results, okay? Hello everybody. We are now doing lipo, and we are doing the knee complex here on Terry, and you'll see me working from a number of different directions. Right now I'm working directly on the front part of her knee. This is one area that all doctors are taught, oh, stay away from that. Can't do that area. It's not true. It's very important to do this area, but it's certainly not easy to do. I've just been working on it for a very long time, and tight, tight, tight. Okay. Tight, Terry. Okay. And I'm telling Terry to tighten her muscles, because without her tightening her muscles, I can't control this fat in a fashion that allows me to do it smoothly. If her leg was loose and wobbling around, I'd be getting fat, but I wouldn't be creating a very nice shape. Because this is sculpting. And it's very important when you're sculpting to be very controlled. We're not just digging a hole, we're shaping something in a very strategic fashion, very artistic fashion. So why don't you talk to Terry up there? How's it going, Terry?
It's going good. I'm numb, so
You're numb.
Feel a little pressure, that's all.
So, how are your nerves right now?
They're good. I guess I'm just a little on edge because I can't see. But I don't feel anything.
Okay. How was the numbing step, which we completed a little while ago?
I guess that would be the worst part for people who are interested in knowing like which is the worst part. It's not.
What did it feel like?
A little burning, not for long, maybe a few seconds, less than 5 in each area, just a little sting. Not a big, huge needle. And I hate needles.
Yeah, you were telling me that you wanted me to count it down for you.
Yeah, I wanted him to do 1, 2, 3, but we just pretty much did a sting and go.
I just went and did my thing, huh?
Yeah, he did his thing.
Because you were just fine with it.
Yeah, made me feel comfortable.
So, I know we were talking about this earlier, but the knee complex, we are trying to really achieve a slimming that comes to the very narrow point right here at the knee. We don't want the knee to be the bulging outward curve. We want it to cut inward and slim, taper inward from all directions, from the bottom, from the top, all the way around in a 360-degree fashion. That's how a nice looking knee is shaped. So I'm working it around here, I'm working around here. This knee complex is it's a new thing because I've been doing this for a few years and there's no term to describe it. Maybe the most, popular way of describing going all the way around now is a term called 360. So some doctors started using the term 360 to describe going all the way around the tummy and the waist instead of just doing part of it, which I'm glad that the industry is moving that way because that's how I've always done things, going around, doing it very completely. But what we're doing today, I haven't seen anyone do or describe, so I've named this the knee complex. It's not just a knee, it's going halfway up the thigh, it's going halfway down onto the calves, and you really need to do that entire area to make it blend properly and create that inward sloping from above and below, and from both inside, outside, all the way around. And having our patients completely awake like Terry is right now allows me to work in this fashion. Okay, so I can go like this, hold this, let's move, hold it right there, Terry.
Okay.
Okay, it's like her leg is being held in a vise so that it doesn't wobble and move around, and I can apply the pressure where I need to sculpt it down. Hey, okay, hey Terry.
Hi.
Hi, hey everybody, we just finished one knee and Terry hasn't seen because we like to make it a surprise, so you want to sit up here?
Okay.
Okay, you can take a look.
Okay, I can get down?
Yeah, you can get down.
Step right there.
Whoa.
Okay, so yeah, you go down. You just take a look on this
Wow.
video. So bring the legs a little bit further apart so you can see the difference
Okay.
between the two. Okay, so we have the one that's tapering in and sloping in, to a thin knee, and we have the other one which is still, kind of flaring out and wide.
Wow.
Turn and face this way, Terry.
Okay.
You're in the way.
Oh, sorry.
Okay, there we go. Hello, Terry.
Hi.
How are you doing?
Good.
You ready to see the second side done too?
Definitely.
Okay, let's sit you up, okay?
Okay.
Come on down. How was everything?
Quick. Wow. Whoa. Look at that.
Is that shapely?
Yes, my knees don't touch.
Yeah.
Wow. I'm in disbelief.
Is that like voluptuous legs?
Yes, I never thought. Wow.
Okay, so
You're cute.
here, turn facing me. Okay, that looks nice. Turn all the way around the other way. Let me see the back side. Okay, awesome. Okay, great. You go ahead and take a look here. And was it difficult?
No, just the numbing.
You had some stings, right?
Yeah, just a few stings, but wow. I'm speechless. Whoa. I didn't even think it was possible at all.
Okay. And you were telling me you had some doubts about
I did.
what you were going to see, right?
Even though I seen it done to other people, it's just me. It's mine. This is me.
This is you.
Wow. It goes with my body. It's not.
Right. So we talked about the concepts of proportions and everything, right? And,
Yes.
And how doing your ankles would not have been good because it would have left your legs looking blocky. But as a doing an area that would really benefit everything. That was the area, right?
Yeah.
And as I was explaining to you, and I'll tell the viewers out there, the knees are like the waist right here. If you don't have a cut-in waist, you don't look good. If you have a straight waist or a bulging out waist, it doesn't look good. Your middle part of the body has to be slender. Same thing with the legs. The legs have to have that little slimming down at the middle, just like the waist. Okay. All right. Any words for our viewers?
Yes, it's possible. I never thought it was. How many years I've been searching, and
but you can believe it.
I believe it.
You believe it now?
And a lot of people are gonna believe it when I show them.
Thank you, Terry.
Thanks
for coming in. Bye bye.